What does it mean when an Alzheimer's patient stops eating? People with Alzheimer's disease can slow down or stop eating or drinking for many reasons. A new or worsening illness, a cold, urinary tract infection, stomach problem, chronic illness, or even constipation can make someone eat or drink less. Depression or anxiety, people who feel sad and anxious may not want to eat. What are the symptoms of the final stages of Alzheimer's? Symptoms of late-stage Alzheimer's disease: increased susceptibility to infections, including skin infections, difficulty walking and moving, eventually resulting in the person becoming chair-bound or bed-bound, loss of the ability to communicate through words, groaning, grunting, moaning, difficulty swallowing and eating. How do Alzheimer's patients die? Although Alzheimer's disease shortens people's lifespans, it is usually not the direct cause of a person's death, according to the Alzheimer's Society, a charity in the United Kingdom for people with dementia. Rather, people die from complications from the illness, such as infections or blood clots. When should a dementia patient stop eating? But if the person appears indifferent to eating, or shows other signs of not wanting food, turning away, not willingly opening their mouth, spitting food out, coughing or choking, the document says attempts to feed should be stopped. And the guidelines tell caregivers to respect those actions. What is the last stage of Alzheimer's? Stages 7, very severe decline. Stage 7 is the final stage of Alzheimer's. Because the disease is a terminal illness, people in stage 7 are nearing death. In stage 7 of the disease, people lose the ability to communicate or respond to their environment. How long does last stage of Alzheimer's last? The general stages of Alzheimer's disease: stage average time frame mild or early stage 2 to 4 years, moderate or middle stage 2 to 10 years, severe or late stage 1 to 3 years. What are 5 physical signs of impending death? 5 physical signs that death is nearing: loss of appetite. As the body shuts down, energy needs decline. Increased physical weakness. Labored breathing. Changes in urination. Swelling to feet, ankles and hands. Do Alzheimer's patients know what's going on? Alzheimer's disease progressively destroys brain cells over time, so during the early stages of dementia, many do recognize something is wrong, but not everyone is aware. They may know they are supposed to recognize you, but they can't. What are the first signs of your body shutting down? They could have different sleep-wake patterns, little appetite and thirst, fewer and smaller bowel movements and less pee, more pain, changes in blood pressure, breathing, and heart rate, body temperature ups and downs that may leave their skin cool, warm, moist, or pale. What is the life expectancy for a person with Alzheimer's? Rate of progression through Alzheimer's disease stages. The rate of progression for Alzheimer's disease varies widely. On average, people with Alzheimer's disease live between 3 and 11 years after diagnosis, but some survive 20 years or more. The degree of impairment at diagnosis can affect life expectancy. What is the average life expectancy for someone diagnosed with Alzheimer's after age 60? Life expectancy varies for each person with AD. The average life expectancy after diagnosis is 8 to 10 years. In some cases, however, it can be as short as 3 years or as long as 20 years. How do Alzheimer patients feel? They go on to provide similar examples for every feeling about which they write: loss, isolation and loneliness, sadness, confusion, worry and anxiety, frustration, fear, paranoia, and anger. Do dementia patients lose their appetite? Appetite changes as a result of dementia. As most caregivers know, many people who have dementia experience sudden changes in appetite, which can lead to appetite loss, weight loss, or increased cravings of sugary foods and weight gain. How long can a dementia patient live without eating or drinking? When someone is no longer taking in any fluid, and if he or she is bedridden and so needs little fluid, then this person may live as little as a few days or as long as a couple of weeks. In the normal dying process, people lose their sense of hunger or thirst. Should you force a dementia patient to eat? Unfortunately, refusing to eat and/or a lack of appetite is a common aspect of dementia, which can be a great source of concern and frustration for caregivers. Forcing your loved one to eat is not an option, however, since they may choke or accidentally inhale food into their lungs. Why do Alzheimer's patients stop bathing? People with dementia may become resistant to bathing. Such behavior often occurs because the person doesn't remember what bathing is for or doesn't have the patience to endure lack of modesty, being cold or other discomforts. Loss of independence and privacy can be very difficult for the person with dementia. Is Alzheimer's inherited from mother or father? En español, if your mother has Alzheimer's, you are more likely to develop the disease than if your father has Alzheimer's, according to a study published today in the journal Neurology. The study adds to a growing body of evidence that a tendency for the disease appears to be passed down through the mother's genes. What is the greatest risk factor for Alzheimer's disease? The greatest known risk factor for Alzheimer's is increasing age, but Alzheimer's is not a normal part of aging. While age increases risk, it is not a direct cause of Alzheimer's. Most individuals with the disease are 65 and older. After age 65, the risk of Alzheimer's doubles every 5 years. How long is stage 4 Alzheimer's? Stage 4 lasts about 2 years and marks the beginning of diagnosable Alzheimer's disease. You or your loved one will have more trouble with complex but everyday tasks. Mood changes such as withdrawal and denial are more evident. Do Alzheimer patients sleep a lot? If you know someone with Alzheimer's, you may notice that they often spend a lot of time sleeping, especially in the disease's later stages. Rather, the changes in the brain caused by the degenerative disease can interfere with a patient's circadian rhythm, the daily cycle that helps determine someone's sleep patterns. How long do Alzheimer's patients live in stage 7? Functional Assessment Staging Test (FAST) Stage Patient Condition Expected duration of Stage 6 Moderately severe Alzheimer's. Average duration of this stage is 3.5 months to 9.5 months. Stage 7 Severe Alzheimer's. Average duration of this stage is 1 year to 1.5 years.